Mike? Mike, can you hear me? Can you hear me, Mike?
Okay, good afternoon, everyone. Thank you for joining us today. My name is Mike Montez, and I'm one of several personal advisors here at MediGap Advisors, and I'll be your host for today's meeting. My colleague, Mr. Will Sheridan, is also going to be joining us today to discuss what we need to know about Medicare's annual open enrollment period and how to best take advantage of this short window of time that folks are given each year. So today's presentation will be focused on this topic, open enrollment, and what it means to you. And we're going to do our very best to make material as easy to understand as possible. And during next week's webinar, you'll learn all about Medicare Advantage plans, also known as Part C of Medicare. So stay tuned for all about that, or visit our website to register. It'll take us approximately 20 minutes or so to go through this valuable information. If you stick with us until the end, you'll be completely prepared to take maximum advantage of this important time frame. And more importantly, you'll learn how to save lots of time and eliminate frustrations year after year with our help. The information we'll cover today can potentially end up saving you thousands and even tens of thousands of dollars during your lifetime by helping you make the right choices and decisions about your health care. And to avoid distractions, we did attempt to mute the line. Unfortunately, we had a little technical difficulty, so we'd appreciate it if you can mute your lines from your end. And at the end of the presentation, we'll go ahead and some questions. You can also use the chat box that's available to the right side of your screen to type in your questions as you think of them, and we can address those at the end as well. And the disclosure I have to make is due to Medicare's strict guidelines, this webinar is intended for educational purposes only, so we won't be able to address anyone's plan-specific questions or how one carrier compares to another. However, we will give you some exact instructions on how you can go about getting those specific types of questions answered if you do have any at the end of our session. And lastly, I want to note that MediGap Advisors is not affiliated or endorsed by CMS, Medicare, or any other federal organization or state agency. So with that said, let's go ahead and get started. So Will, what can you tell us about the open enrollment period?
Thanks, Mike. Let's start with the choices you have in Medicare to get your Medicare benefits covered. You can choose Original Medicare. Many beneficiaries will purchase a MediGap policy to help cover the expenses they are responsible for after Medicare pays. Many of those same beneficiaries will also choose to enroll in a Medicare PDP or prescription drug plan to help cover the cost of their medication. The second choice is a Medicare Advantage plan. These plans are offered usually with, or could be without prescription drug coverage. It is simply another way to get your Medicare benefits. It combines Parts A and B, and usually Part D, Medicare prescription drug coverage. They are managed by private insurance companies approved by Medicare. These plans must cover medically necessary services. However, plans can change different co-payments, co-insurance, deductibles for these services as opposed to Original Medicare. Here are some of the key dates that we wanted to cover. In September, the Medicare and new booklets were sent out by CMS and Medicare. By the end of September each year, plans must provide the annual notice of change and evidence of coverage to existing members. It is intended to outline benefit changes for the upcoming year, including changes in cost sharing and drug tier structures. On October 1st, plans were allowed to start marketing. So it's likely by now you've gotten lots of information from many different carriers in the mail. One of the things that we can assist you with here at MediGap Advisors is cutting through all the clutter and simplifying your options to make a decision much easier. 2015 plan data was available around that October 1st timeframe as well. On October 8th, plan ratings were updated for plans based on past performance, and the open enrollment or Medicare open enrollment period began on October the 15th. It will run through December 7th when it ends. If you enroll in a plan or change plans during the 7-week period, you can expect your coverage to begin on the 1st of January 2015.
Will, I think you maybe skipped one slide, the previous slide, this one here. That's okay. If not, we can jump ahead here.
Okay. Which should I skip, Mike?
It was the Medicare open enrollment slide. Previous to the key dates.
Previous.
But if not, we can jump straight ahead. Fine.
Yeah, why don't we just jump ahead? I think we'll be mentioning it again.
All right.
So each year you have the opportunity to review your choices and pick a Medicare health and or drug plan that works best for you. Our certified advisors can help you determine this and walk through the entire process from start to finish. The time frame for the open enrollment period, again, is October 15th and goes through December 7th. This gives people with Medicare a full 7 weeks to compare and make decisions and helps ensure that they have essential plan materials and membership cards in their hands by January 1st when their new coverage starts. Keep in mind this period, often called AEP, or annual election periods, only applies to making changes to Medicare Advantage plans, Part C, or drug plans, Part D. It does not apply to changing Medicare supplement plans if you have one. Medigap plans can be changed at any time of the year, but you may be subject to underwriting. So we'll touch on this later as well.
Okay, I think that's the one you had skipped before, so we're back on slide number 5 now.
Okay. Each year, Medicare plans can change what they cover and cost, and they must inform you of these changes each year, and you should have got that back in September. The evidence of coverage gives you details about plan coverage, cost, etc. The annual notice of change involves changes in coverage, cost, and service area effective January of the following year. Some plans may choose to leave Medicare. Is your plan leaving Medicare? We can help. Health and prescription drug plans can decide not to participate in Medicare for the coming year. If that's the case, your plan would have sent you a letter before the start of the open enrollment period if you decided to leave Medicare or stops providing coverage in the area. Members whose plans do not renew their contracts have a special enrollment period that began on the 15th of October and runs through the end of February of next year. Before you make any changes, you should consider what your coverage needs are. Do you have or are you eligible for other types of health or prescription drug coverage through a former employer or a union? If so, read the materials from your insurer or plan carefully and call to find out how the coverage works or is affected by Medicare. Talk to your benefit administrator, your insurer, your personal advisor before making any changes to your coverage. If you drop your current coverage, you may not be able to get it back. When it comes to cost, how much are your premiums, your co-insurance, your co-pays, deductibles, and other costs? What is the out-of-pocket limit if you have one? Your costs may vary and may be different if you don't follow the coverage rules. How about doctors and hospital choice? Do you have the doctors and healthcare providers that you want accepting the coverage you have? Are there doctors you want to see accepting new patients? Do you have to choose your hospital and healthcare provider from a network? Do you need to get referrals in that? For prescription drugs, do you need to join a prescription Medicare plan? Do you already have credible coverage in place? Will you pay a tax penalty if you join a drug plan. What will your prescription drugs cost under each plan? Are your drugs covered under the plan's formulary? Are there any coverage rules that apply to your prescriptions? What about your quality care? Are you satisfied with the medical care you receive now? The quality of care and services given by plans and other health care providers can vary. Medicare has information to help you compare how well plans and providers work to give you the best care possible. And don't forget about convenience as well. Where are the doctors you want to go? What are their hours? Do you have a preferred pharmacy that you've used? Can you get your prescriptions filled by mail? Do your doctors and providers use electronic records or paper? Do you travel? And if you do, will you have coverage in another state or if you go outside of the U.S.? Our objective at MediGap Advisors is to make this all very easy for you. We can certainly help answer these and other questions you may have about anything related to Medicare. Okay, an important point that we've touched on briefly, but if you have coverage through an employer or a union, be sure to check with your plan's benefit administrator before making any changes. You could lose coverage for you and your dependents if you drop it and you can't turn back to it, most likely. If you already have a Medicare Advantage plan and want to drop it and join Original Medicare, you have this option during the open enrollment period. In most cases, plans will require a letter from you stating that you wish to discontinue the plan. However, you should know there's no guarantee that an insurance company will be able to give you a MediGap policy because you may have to meet medical underwriting requirements. The exception is if you qualify for a guaranteed issue period. An example being if your Medicare Advantage plan leaves Medicare, you would get that guaranteed issue period. To save you time, advisors like myself are more than happy to help you determine what might be available to you in your area. If you're currently in a Medicare Advantage plan, you're also able to switch to another Medicare Advantage plan simply by joining a new one. If you do, you'll automatically be disenrolled from your old plan. You can switch back to Original Medicare by joining a standalone drug plan. As I stated on the previous slide, if this is your intention, you need to consider or see if you qualify for a MediGap policy. And, of course, that's something we can help you clarify whether it's an option for you. There is also the Medicare Advantage disenrollment period between January 1 and February 14th every year. You can leave a Medicare Advantage plan and switch back to Original Medicare. If you make this change, you may also drop a prescription drug plan, may also join a prescription drug plan to add drug coverage. Coverage begins the first of the month after the plan gets the enrollment form. Check to see if you'd be able to get a MediGap policy to help pay the gaps Original Medicare doesn't cover. You might have limited or no options depending on the state you live, but we can help you determine what those options might be. Some plans don't renew all of their plans. This is usually based on the plan's business decision. Sometimes Medicare will take a sanction or action because of a problem with the plan. In this instance, you can switch your Medicare Advantage or Medicare PDP to another plan. You can switch. Your chance to switch is determined by Medicare on a case-by-case basis. Sometimes Medicare will terminate a plan's contract, and you have a special election period. If that's the case, you can switch from your Medicare Advantage or PDP plan to another plan. Your chance to switch lasts until 1 full month after Medicare ends the plan's contract. If your Medicare Advantage plan, prescription drug plan, or cost plan is not renewed, you may join another Medicare Advantage or PDP plan between October 15th and February 28th of 2015. If you join a plan between October 15th and December 31st, your coverage would begin January 1st. If it's between January 1 and February 15th, it will be effective the first of the following month. Per regulatory requirements, plans must notify Medicare about non-renewal decisions by the first Monday in June. So if they were not renewing, you should have been notified by now. Those affected can take advantage of a special election period like I just mentioned. The last point we want to make about open enrollment is that messages in the media are increasing about the new health insurance marketplace. Many Medicare beneficiaries may become confused and think they need to enroll in a marketplace plan. Please know that if you have Medicare, you're covered, and the marketplace will not require you to do anything different, that there have not been those changes to Medicare. The bottom line is your Medicare benefits aren't changing. Marketplace plan or changes to the marketplace do not affect your Medicare coverage in any way. Medicare is not part of the individual health marketplace. And the Medicare open enrollment period, lasting until December 7th, is the time to consider and renew your health and drug plan options. I'm going to turn it back to Mike to finish things up here.
Thank you, Will. I appreciate that wonderful explanation on what you can and can't do during the annual election period and how a person with Medicare can maximize their time. It's very valuable information that folks can continue to use every single year to understand their choices during open enrollment. And as a reminder, the enrollment deadline will be here before you know it. So we urge you not to wait until the last minute. If you're not yet working with one of our friendly Medicare experts, simply call the main line toll-free at 1-866-323-1441, the number on the screen, and your call will be routed to a licensed advisor that can assist you. From that point forward, you'll be able to communicate with your personal advisor via email or phone whenever you have any questions at all about Medicare. You can also schedule an appointment directly on the advisor's calendar for a day and time that's convenient for you. And because it's our busiest time of the year, of course, a number of appointment slots have already been taken. So again, call the main line if you don't have an advisor assigned to you. If you are working with us already, reach out to your advisor directly by phone, email, or by adding yourself to the calendar. We'll answer all of your questions, get you in the right direction, and help you determine the best course of action for your situation. Keep in mind that we represent all the top carriers and plans throughout the country, so we can help you find the plan that works best for you and your situation. And each year we'll conduct an annual comprehensive policy review to ensure that you're always kept in the highest value, lowest premium plans available. Best of all, we can do everything for you from start to finish at absolutely no cost to you. And with that said, that concludes today's presentation. We will go ahead and open up the line for any questions there might be out there. In the meantime, I'll go ahead and show a couple of Will's many excellent testimonials from two very satisfied clients. So if anybody has questions, I will go ahead and address some of those right now. Let's see if there's anything coming in the chat box here. Any questions out there? Okay, well, once again, there's no questions at the moment. We want to thank you for taking the time out of your schedule to join us today. Will, you must have done an excellent job in presenting that because no questions are coming through at this point. We do hope that you got some value out of the presentation. I also want to remind you of our upcoming webinar focusing on Medicare Advantage plans. That is going to be taking place next week at the same time on the same line. So we hope to see you there. Hope you have a great evening, and bye for now.